Hello everyone and welcome to this channel. Today we will talk about the last process of pharmacokinetics, which is elimination of drugs. As we discussed in our previous video, drugs must be sufficiently polar to be eliminated from our body. So removal of drug from the body occurs via a number of routes, and the most important one is elimination through the kidney into the urine. And this route of elimination involves in three main processes, which are the glomerular filtration, the active tubular secretion, and the passive tubular reabsorption. Basically, drugs enter the kidney through renal arteries, which divide to form a glomerular capillary plexus. So, free drugs which are not bound to plasma proteins like albumin, only those free drugs flow through the capillary slits into the Bowman space as part of the glomerular filtrate. And the factors that can affect this process, like the glomerular filtration process, is the variation in glomerular filtration rate and the protein binding of drugs. Protein binding of drugs is very important here because only those who are not bound to proteins can pass this process. So other factors like pH and lipid solubility will not be affecting this process. So if the drugs that were not transferred into the glomerular filtrate, they leave the glomeruli through efferent arterioles which divide to form a capillary plexus surrounding the nephric lumen in the proximal tubule. So here in the proximal tubules, the secretion process mainly occurs here, and it used two active transport systems. If you remember, the active transportation, it requires energy. So one of these transport system will be for anions, and the other one is for cations. Anions, for example, deprotonated form of weak acid, and cations and protonated form of weak bases can be an example. These transport systems show low specificity. That's why they can transport many compounds, and there will be competition between drugs for the carriers that can occur with each transport system. As a drug moves toward the distal convoluted tubule, its concentration increases and it exceeds that of the prevascular space. That's why if the drug is uncharged, it may diffuse out of the nephric lumen and it can go back to systemic circulation. So there's an important process and concept in elimination process which is called ion trapping. This is used to manipulate the urine pH so that to increase the fraction of ionized drug in the lumen, and this will lead to minimize the amount of reabsorption and increase the clearance of undesirable drug. And as a general rule, weak acid can be eliminated by alkalinization of the urine, while weak bases can be eliminated by acidification of the urine. As we said, the kidney is the main organ for elimination, but the drugs can be eliminated via other routes like the intestine and the bile or the lungs, and also breast milk. So if the drug were not absorbed or they were secreted directly into the intestine or into the bile, they will be eliminated into the feces. And for the lungs, they are primarily involved in the elimination of anesthetic gas like isoflurane. And elimination into breast milk may expose the infant to medications and which can lead to side effects to the infant. Can be also other routes of drug elimination like sweat, saliva, tears, hair or skin, but this is very small ratio. Thank you for watching. Please don't forget to subscribe to this channel.